Hello friends, I am Dr.ashvath.kulkarni. I'm a dentist at Kulkarni Clinic. It's been a while since we made any videos and spoke to you. I thought I'll take this opportunity and connect back with you guys. I've been traveling and I've been busy with a couple of things, so that's the reason for delay with this video series. Of course, Dr. VC Kulkarni is in Bombay. And soon we will have him on board as delivering some of his interesting videos. Today, the topic I chose is orthodontics and aligners. Now, in dentistry, there is a branch called as orthodontics, which deals with crooked teeth, oddly shaped teeth, oddly placed teeth, teeth when they're misaligned. So proper alignment of teeth as per some of the standard guidelines in a class 1 occlusion, what we call ideal class 1 occlusion. The science behind it, the biology behind it, the surgical science behind it, the mechanics behind it, the material science behind it is called as orthodontics. And in today's modern age, with advent of 3D scanning, 3D technology, 3D printing, different materials, in the last 5 to 7 years, 10 years, we have seen a lot of improvement in this aspect, and there is a new branch of sub branch of orthodontics, which is aligners. Of course, there are many systems of aligners. One of the first few aligners were called as Inman aligner, Clear aligner, Clear Path. In India nowadays, you hear Virat Kohli and Anushka Sharma talking about Tutsi. There are other aligner brands like Odonto, and there is a new Japanese system called as Kyo aligner. Of course, I'm not trying to promote any brand or any particular product. I'm very clear about that. I had to mention it so that people can relate to what I'm talking about. So basically, these aligners are meant for helping dentists and orthodontists work on patients with misaligned teeth. So here, if I can hold this chart, there are several examples of how misaligned teeth are, right? These are just examples. So crooked teeth, misaligned teeth, they pose a lot of health issues, a lot of temporomandibular joint disorders, stress on the muscles, muscle stress, imbalance in the occlusion, imbalance in the way the upper and lower teeth come in contact with each other, might lead a lot of unwanted stress and strain and mechanical problems with the muscles around the jaw. So this is the temporomandibular joint here. This joint near the ear on the outside surface called the temporomandibular joint. So any misalignment, it is not just about cosmetic reasons to get it corrected. It's also about functional and mechanical aspects to control temporomandibular joint disorders. There are many instances wherein people have undergone a lot of headache-related treatments, and there are hundreds and thousands of different types of headaches. They have been on different types of medications, but the simple problem has been misalignment of teeth. And this misalignment, once it is corrected, the neuromusculature, the nerve supplies and the muscle action in and around the temporomandibular joint gets corrected, gets balanced. It's like a cycle, right? So if you have the chain is not stuck in those gears properly, you'll have to put a lot of efforts to push the cycle forward, right? So similarly, if the alignment of the teeth is not proper, if the upper and the lower teeth don't join together properly, the muscles have to work extra to make sure that the grinding process happens in a very efficient manner. So to get it into alignment is very important. Recently, we have started understanding a little bit more about a Japanese system called as Kyo Aligner, Kyo Clear. This was invented by a doctor. That's why I'm more interested in this type of a system. Of course, I'm not trying to promote any brand or anything, but it's a system, right? So there is a particular protocol which the doctor has decided, and he has worked on that. The Japanese doctor has worked on it, and it has proven to be successful. Here we can see that we can manage a lot of issues like crowding, like overjet, underbite, spacing, open bite, deep bite, and midline discrepancies. So we can work on this. Here you can see there are only 2 teeth which are popping out. They are not in that perfect U shape. So we try to bring it back into that U shape. Here there is a gap between the front 2 teeth. We try to close those gaps. Here there are some teeth which are rotated or angled, and we try to bring it back into angle. Here there are teeth are closing excessively deep and touching the lower lip more than what it is necessary. In such cases, we do some corrections, and there are teeth which are crookedly placed, especially teenage children and their parents get a little bit of anxious feeling, and especially in ladies, girls, that okay, my daughter is reaching a marriageable age. This is the most common complaint I hear. Then can you do something about correcting the teeth so that she looks much more beautiful? See, beauty is just one small component. The whole idea is to look at the neuromuscular apparatus, the temporomandibular joint as a whole, and the social 6, what we call canine to canine. When we smile, we show up those 6 teeth. Those social 6 teeth, yes, they are very important for cosmetic reasons. We can do a lot of corrections. And in today's age, when girls and women are doing really well, it's not just about girls or women, it's about every working professional out there who needs to be more presentable when they go and meet international clients or meet their clients, participate in meetings. This is not just about beauty aspects. This is also about increasing the self-confidence of people, of patients. So if you have any questions about aligners, if you have any questions about orthodontics, if you have any questions about correcting the misaligned teeth, please write in a message, please drop by a message. I'll be happy to talk to you. I'm in Bangalore for the next 3-4 weeks, and looking forward to meet you. And while I am preparing to do these videos, I also get to learn many things. So it's a learning exercise for me as well. Thank you very much for your time and patience, for having given time to listen to these videos. I appreciate it, and keep supporting us, keep helping us, hit the like button, hit the subscribe button, and looking forward for many more interactions.